Welcome to the deep dive. We're here to basically be your shortcut to getting properly informed. We take your sources, pull out the key nuggets. Today we're looking into manic disorder. You probably know it just as mania. In our source material, it describes it as a mental health condition with this abnormally elevated mood. Think very high energy, overly talkative, sometimes quite irritable, actually.
Exactly. And our goal for this deep dive is really to pull the essential insights from your source on specifically the nursing management of mania. So we're focusing on those practical care strategies. What do nurses actually do? We're going to touch on, I think, about 8 core areas mentioned in the material. Things like environment, safety, communication.
Right. And medication, self-care, behavior, family support, and keeping track of it all, the documentation. And here's where I think it gets really interesting, how all these structured sort of practical steps actually work together, especially when you're supporting patients dealing with such a high energy, sometimes, chaotic state. So let's maybe unpack those strategies.
Okay, yeah. First up, environment control. The source really emphasizes a calm, structured setting. And the crucial thing here is why. You're trying to avoid too much stimulation like loud music or bright lights because the brain's already sort of overstimulated, right? So external stuff can just make agitation worse. A quiet area really helps.
That makes total sense, kind of fighting internal chaos with external calm. So building on that, safety, obviously huge. The source talks about monitoring for aggressive or risky behavior and removing harmful objects. But it's that balance, isn't it? Maintaining trust while ensuring safety. Using restraints only as a absolute last resort following policy.
Absolutely, a very delicate balance. And when you're navigating that, your communication technique is vital, the source says. Simple, clear, direct language. Actively avoid arguments. And keep a firm but kind tone. The why, again, is key. Processing complex stuff can be hard in a manic state.
Yeah.
So direct communication just helps prevent misunderstandings, prevents more agitation.
Yeah, that firm but kind approach sounds crucial for keeping things calm. Okay, shifting gears a bit. Medication. Our source talks about correctly giving prescribed mood stabilizers, lithium's the classic example, and antipsychotics, maybe like olanzapine. What's the thinking there?
Well, it's interesting, right? Lithium helps kind of level out those extreme highs in the mood itself. Antipsychotics are often brought in more rapidly sometimes to manage really acute agitation or maybe even psychosis if that's happening during the episode. And of course, watching closely for effects and critically side effects, that's just non-negotiable.
Right. Compliance with meds sounds like a real cornerstone.
It really is. And then beyond meds, there's helping with self-care and daily routines. This is so important. Patients in a manic state, they can feel so high, they just neglect basic needs. So nurses help with hygiene, making sure they're eating, getting enough fluids, and sleep. Trying to maintain proper rest is huge because that often gets severely disrupted.
It's easy to forget those basics when someone seems so energized. And then behavior modification comes up.
Yeah, the source talks about positive reinforcement for positive behavior and gently redirecting negative behavior. It's not about punishment at all. It's more about setting clear, consistent boundaries that helps the patient regain a sense of control, predictability,
Right.
which is actually really grounding for them.
Consistency, right. That seems key.
Definitely. Moving outward, family counseling and education. This is vital for the long term. You need to educate the family about the disorder itself, give them practical home care strategies, and really stress why sticking to medication is so important. It empowers them, helps them spot early warning signs, provide that ongoing stability.
Yeah, that family support network can make such a huge difference for long-term well-being.
Okay, and the last piece mentioned was documentation.
Right. Seems basic, but it's crucial. Daily recording, mood, behavior, meds given, what the nurses did. This daily log, it's not just paperwork. It's how you track progress, how you adjust the care plan quickly if needed, and ensure everyone's on the same page, shift to shift.
So it's the glue holding the whole strategy together, in a way. Exactly. So we pull it all together. The source really highlights some key takeaways for mania care. Remember, high energy, yes, but judgment is often poor. So safety, always the absolute first priority. Communication needs to be simple, direct, always. And for things to work long-term, medication compliance and family support are just incredibly important.
So thinking about this, what does it all mean for you listening? I think it really shows the incredible level of detail, the strategic thinking, the dedication that goes into managing complex mental health conditions like mania. Every single piece matters, from the room's lighting to how you phrase something. It all makes a difference in guiding someone through that episode.
Yeah. And it makes you think, doesn't it? It raises this question.
Yeah.
Okay, beyond the hospital, how can these core principles we've talked about, creating calm, ensuring safety, communicating clearly, the things needed for mania nursing, how could those maybe be applied more broadly to support well-being in really any high stress or potentially chaotic situation we might face?
That's a really interesting thought to leave people with. Definitely something to ponder. Thanks for joining us on this deep dive.